We now have our final panel discussion of this summit, Behavioral Health Legislative Champions, What's Next for Children's Behavioral Health? This year, we saw the passage of Chapter 177 of the Acts of 2022, the Mental Health ABC Act. Our panel will discuss the Act, its ongoing implementation, and how the legislator plans to continue to address youth mental health. We are joined by 3 of our local elected leaders who have devoted much of their time in public service to the improvement of behavioral health care in the Commonwealth. Senator Cindy Friedman of Arlington currently serves as the chair of the Joint Committee on Healthcare Financing, the vice chair of the Joint Committee on Ways and Means, and the vice chair of the Joint Committee on COVID-19 and Emergency and Management. Representative Marjorie Decker of Cambridge currently serves as the chair of the Joint Committee on Public Health and previously served as chair of the Joint Committee on Mental Health, Substance Use and Recovery. Representative Adrian Madaro of East Boston is the chair of the Joint Committee on Mental Health, Substance Use and Recovery. All 3 of our esteemed guests were critical in developing and passing the Mental Health ABC Act and are passionate behavioral health advocates. Before we begin, I would just like to thank you all for making this major piece of legislation happen and for all you continue to do. And I'd like to introduce Nancy Allen Scannell, Director of External Affairs at the Massachusetts Society of the Prevention of Cruelty to Children, who will be moderating this panel. Nancy.
Thank you. Oh, boy, I never, ever like seeing pictures of myself, and you guys had to pick the one where I lost a fight with a carrot in my hair. Jeez. Okay, whatever. Just want to keep me humble. You did your job. Good work. Well, greetings. Hey, this has really, really been a wonderful day, right? So I want to first shout out to everybody who worked so hard to make this possible, the team at the Mass Hospital Association and our dear colleagues at Boston Children's Hospital. You guys are rock stars. This was a great, great day. And so I am the Director of External Affairs for MSPCC, and very proud of that. But we are part of the leadership team of the Children's Mental Health Campaign, and that's really why I'm standing here. And so we've gotten a few shout outs during the day, and I want to quickly ask anybody out there still who's on Team CMHC to just raise your hand, because there's a bunch of us in the room, right? So it's a big group of people. Now hang on, because I also want then any of you who are our close allies, collaborators, key informants, alumni, Kate Guinness, raise your hand too, right? Okay, so it's most of the room, and I think that that's probably what's really important about this next panel, is that these guys are truly the smartest, most hardworking, most committed, kindest, truly kind in their snarky sort of way sometimes, but still very, very kind individuals in the state of Massachusetts, and we are so fortunate to have them as our friends and our allies in the development of this bill that so many of us contributed to. I think probably everybody in this room contributed a thought, an idea, hours and hours of work in some cases, to help work side by side and hand in hand with this group of folks to develop this landmark legislation that really is going to have a huge impact on the lives of kids and families over a really long time. So before I turn to them, I do want to make sure that I do one other thing, which is to shout out to our dear friend and Senator Rep. Madaro's co-chair, Senator Julian Sear, who couldn't be with us today, but really was another key part of the team that made this happen, along with the Speaker of the House and the Senate President, without whom this would not have happened either. So I have 3 questions, right? And they got them in advance because there's no gotchas here. But I thought since this group of people knows this bill so well, although I have to tell you, right, some of us, when we read it, we went, oh, that was nice. I didn't see that one at first. So there's a lot in there. But we have the chance as advocates to get to know these guys differently and to hear the strength of their passion. And so I thought this first question for each of them could be, what is the thing about this bill? What's the provision in this bill, or a couple of provisions, that are most personally impactful and meaningful to you, not just as legislators, but as parents, as aunts, uncles, and people who care about kids? So, Senator Friedman, let's start with you.
Well, thank you. It's wonderful to be here.
You got to push the button, turn it green.
Oh,
Yep.
okay. Thank you. It's wonderful to be here. I think this is hysterical that we're sitting here telling you guys what's in this bill. I just think it's just so funny. You know, there's so many people in this room that we have spent so many hours, so many days going over words and phrases. And I will also say that when we signed this bill, it was like being at a wedding. There was such joy and excitement, and I mean, people were so happy we were all almost crying. So this is just a huge, incredible endeavor that all of us have created. And so I want to thank you, and I feel like, you know, I'm talking to the experts here. So I think the 2 pieces for me, and I picked 2, and there's an enormous amount of stuff in this bill, as you all know, but I think the 2 that really mattered to me and that I think I probably worked on the longest over the years is the parity and ED boarding. I don't need to tell you about parity. I mean, what a friggin' joke it's been. And I feel like we have really cracked the nut on parity, Wells. I really feel like this is finally, we're getting some teeth into this. Finally, we've really moved from, yeah, there should be parity, let us all know that you're doing the right thing, to you got to prove it, and that there's real enforcement in that. And I think that's really going to make a big difference, I think. And we can talk about later, because I know what the next question is, but I think that was critical. And then the other one, which is certainly a symptom and not a cause, not a sort of fundamental core cause of the crisis that we are engaged in now, but the ED boarding is, you know, something that is just, you know, we hear about it every day. You hear about it every day. It is just, besides inefficient and kind of wasteful in a lot of ways, it's inhuman. And so I think that is the other piece that I feel like we have finally made some critical fixes. You know, the portal is incredibly important. The having on-site care is important. You're requiring, and I know that this is to some extent yet another burden on our hospitals, but we can't just let these people sit and these kids sit in these rooms. And so I think that's really important. And then I think the other piece that I know we've been working on is this whole, independent evaluation. When a child with a lot of mixed dual diagnosis and comorbidities comes into emergency room, they're the kids that sit around for hundreds of days. And I feel like we've really moved that needle by basically addressing the issue of cost. Who's going to pay for this? And so what we found so many times is if you're a kid who happens to have autism, you have OCD, you have, an anxiety disorder, you're the kid that sits there the longest. And when you uncover it, when you keep looking, what you find is that it's often the adults in the room can't figure out how to pay for something. And I think we've really gotten to the core of that by saying, we're not waiting around anymore. You, EOHHS, you, the Department of Education, you're going to take care of this, while everyone else, kind of messes around. So I think wonderful things in that bill, amazing, but those, I think, are the two that I think I've sort of focused on for the longest.
Guess I'm Madaro, the state rep for East Boston. I want to just thank Children's and MHA for bringing us together. It's been a while since I've been back to the Boston Bar Association. I think the last time I was here was for continuing legal education credit. And considering it's right across the street from the State House, I should probably come more often. But really wonderful to be with you all. And I want to first say thank you to everyone in this room. You all practically wrote this bill. Certainly wouldn't be law without your tenacious advocacy and efforts. I got to give a lot of credit to my colleagues, Rep. Decker and Senator Friedman, as well as Senator Sear. I came in at the 11th hour, folks. I'm a brand new chair. I came in to chair this committee 2 years ago, and there was years of work that led up to this moment. And I just want to express gratitude to my colleagues and to all of you for making that a reality. The two things I'd like to highlight that I think are incredibly impactful. First of all, I think we really put an emphasis on trying to be proactive with this bill, trying to stave off worse outcomes, trying to address things early. And two of the things I want to mention align with that notion of being proactive. First of all, an annual mental health wellness exam. I think that is game-changing for folks in the Commonwealth, kids and adults. We all get an annual physical, or we should all get an annual physical. I know I'm guilty for not always going every year. But we know that, for a person, an individual's health and well-being, it's not just about the physical health. Mental health is just as important. And now having the ability to get screened on an annual basis, have it covered just like a physical exam, we're being proactive, and that can stave off worse outcomes and consequences down the road for young people, certainly, also for adults. Similarly, in the vein of being proactive, we were very intentional about bringing the services to where people are at, whether in the community or in schools, right? And I'm particularly proud of the focus we put on youth mental health and behavioral health in this bill. I represent East Boston, as I mentioned. It is a community of color. It's the immigrant town, the gateway town for the region. We've welcomed more immigrants to this country through East Boston than anywhere else in this world, second only to Ellis Island. That creates a lot of challenges and opportunities. But one of those challenges is that folks are disconnected from traditional systems, right? East Boston High School, our local high school, it has more folks of color and more either first-generation students or students who are immigrants themselves than any other public high school in the city. And the truth is, many of them are working hard to help put food on the table for their families, to help pay rent, to, tackle daily necessities that I was fortunate to never have to worry about when I was a kid growing up in East Boston. And so the concept of going to the doctor's office can be incredibly foreign. And time consuming, valuable time that these young people don't have. By bringing these services to the schools. So East High has for a number of years in partnership with our local neighborhood health center, has had a community-based or a school-based health clinic that they embedded with mental health supports. So we were fortunate to have these services before this bill, but that is now going to be a reality for kids across the state. And to bring the services right where they at, it's ensuring that we're doing everything possible to make sure young people are getting the help they need. Physical health, certainly, but mental health as well. And those are two things I'm incredibly proud of, because I really think that through those proactive approaches, we will help move the needle long term and avoid worse outcomes.
Thank you, Nancy. I usually never have a problem being heard. Having it acted on is a different story, but I just, my heart's just filled with gratitude. There's a lot in this bill, and every time I need to look at notes, I go, why do I need to look at notes? I should know this inside and out. What I do know is that when I go through the bill, every piece I go through, I remember who I had conversations with. We, together with the Children's Mental Health Campaign, first of all, all of you in the campaign, I cannot, my heart is filled with so much gratitude for the work that we've done over the last 4 years together. You have made me the advocate that I've wanted to be. And the work that you do on the ground every day with families and children, those with resources and those without, right? Whether you have resources or not, if your child is suffering, it doesn't matter what your resourced family looks like. If you can't get the thing that's the most important to you in the world, the support and the resources that they need. So I always do this, and I'm not going to today. I start naming people. I just look in this room and I think about how many people were involved in this bill. In fact, one of the things we did for the Speaker of the House was put together a summary of, we want you to know who was involved. We put together 100 names of people and organizations that collectively we had conversations with over the last 4 years to really make sure not only was the bill meeting the needs of what the needs were, but to make sure that it was also representative of the different kinds of needs in the different spaces, in the different places, and in the different systems. So for that, I'm really grateful. What's the fire for this bill for me? I'm a mom. I'm a mom of 2. I have middle school children who are now middle school. They weren't when we started this work. I also grew up in poverty. I grew up in public housing. Almost everybody in my family and extended family still lives in poverty in Cambridge. My mom, my brother, lives in government subsidized housing. So many of the families that I serve and work with, I represent a tale of 2 cities, but a lot of my energy is also making sure that people in my community and beyond who are at such high risk for developing mental health needs and acute mental health needs because they don't get met when they need them. This bill is going to ensure that, particularly in our schools, children, one of the most, one of my guides as a parent and as a policymaker is a woman named Alice Cohen, who I know some of you met. I brought her into this, right? And she is really great at telling parents and teachers around the Cambridge school system, I promise you, children will always tell you that they're in need. Now, if you can't understand it the first 20 times, they'll continue telling you, and they'll do it so that it's louder and it's more visible. But don't worry, they'll never give up on telling you that they need help. It's, do we recognize what they're telling us? And when we do understand what they're telling us, what do we do? So much of what is in this bill is about ensuring that we approach children from a behavioral health lens, not from a behavioral problem, not from a punitive disciplinary problem, which is often how many of you, I'm speaking to all of you, know that that's how we approach children. The disparities in race and class, and whether it's a 1-parent or 2-parent household, I think it was Dr. Simon who probably had all of us in tears earlier, talked about, like, you're talking about the same age of various populations, yet the outcomes of how children are being treated. I saw that up there was quoted Dr. Tolliver. I'll never forget I feel so privileged for the conversations we had and really looking at the studies that she did around children's. And when kids are sent to the hospital from school, the emergency room, right? The percentage of children who were sent home quickly was so staggering large, but those who were sent there were predominantly children of color, right? And those who stayed longer and were in greater need were children with ed plans. So I could go on, but there's so much in this bill, and I love looking at each piece of it and truly remembering the conversations that I had with so many of you. And when I left the city council in Cambridge after 14 years, I ran for state rep because I actually thought I want to be able to help more families and children than just those in Cambridge. And through the Speaker of the House, through the incredible work of my colleagues, I have been in place to be in positions to collaborate with all of you so that we could actually impact not only families in our district, but all the families that you touch and families throughout the Commonwealth.
They're great, right? So moments of, oh, good. I think it's important to start with Chapter 177 because celebration is a rarity in our work, and it is so sort of rejuvenating, I would say. Much of today, you guys, has been challenging to listen to, right? There's been a lot of really tough information that has been both jarring, I would say, personally, jarring and motivating. There's more to do. We have been really gratified to hear from all of you and from Senate President, Speaker, and others that this is a multi-year, multi-session initiative. So my next question is, what do you hope to see come of the current level of work? What would you expect to see from that? And what's next in your view? What are the next steps that you'd like to see the legislature and our whole community at large take with respect to kids' behavioral health? We can go in the same order, or, yep.
So I think there's a couple of things. I do expect to see some fundamental changes, I think especially in the insurance space, because it's so clearly laid out in the bill of what you have to do. So there's not a lot of, we don't need to get together and talk about, well, what does it mean to have this or to have that, or how do we do X or Y to bring kids in, that are in the school system. So it's sort of more clearly laid out. And so I think we will see, and I know that I was part of a couple different requests for information or FYI sessions with the DOI. So I know that they're starting to focus on that. I think there's two things that we need to do in the next iteration of this. The first one is we have to pay attention. Because as soon as we stop paying attention, the portal will take a little longer. The education pieces, the school pieces will sort of get a little fuzzier because other things will step in. Okay, this is big changes, big stuff. We all have to pay attention. And when you think about, and I will shoot you all after we leave for telling you this, but when you think about people who don't want their taxes raised. Do you ever not hear their voice? Do they ever miss an opportunity to tell you that you can't raise the taxes, that we want the money back? Think about that kind of voice, and that's the kind of voice we're going to need to continue this battle of making sure that kids get the care they need. So that's the very first thing that I think everybody has to do. It's like, we got to pay attention. It's in the bill. It's been signed. We now need to have that expectation that it gets fulfilled. The second piece is, and you all know it, is we've just got to put 120% of our focus on workforce, because none of this can get done. None of it can get done if we don't solve the workforce issues. And I think we've started in ARPA. We did a great, there's over $120 million just in loan forgiveness for every rung on the ladder of mental health, and that's really important. But we don't really have a pipeline. We're not figuring out how to get people to come into this Commonwealth to do this work. I just don't need to tell any of you that. And so if we don't solve the workforce problem, people will legitimately be able to say, we can't do what's in this bill because we don't have the people to do it. So I think, for me, those are the two things. But, workforce. So that's what we have to focus on next, I think.
Thank you, Senator. I think you hit the nail on the head. Workforce is first of all, we have a lot of monitoring to do on Chapter 177 because there was a lot of forward-looking policies in there that will take time to get ironed out, and it may be the case that we need to tweak things along the way, depending on how it plays out. But workforce is key, and we did make significant investments to the tune of almost $200 million with ARPA to stand up this behavioral health trust fund, with the hope that that will help solve the persistent challenges you've all been dealing with and that we all hear about quite frequently. But one thing that I'd like to see, and we started doing this with the behavioral health trust fund, but I think we need to really double down, is ensuring that the providers look like the folks that they serve, that they speak the languages of the folks they serve. I think about my community of East Boston, and I would say the most common language in East Boston is Spanish. we should have at the East Boston Neighborhood Health Center more Spanish-speaking individuals. We should have more folks who are culturally and ethnically competent when it comes to dealing with the various populations, the beautifully diverse populations we have across the Commonwealth. So I'd like to see us prioritize providers who serve communities of color, providers of color, to make sure that we're getting at kind of the root of those issues of communities that are often, I don't want to say forgotten, but sometimes left behind when it comes to these investments. And in the same vein, another thing that I'd like to see us start to work on is addressing populations with limited English proficiency. Again, I'll use my community of East Boston as an example. Far too often, parents are having to deal with behavioral health plans that are only in English, or patients themselves, young people, are not getting services in their primary language. That, to me, we're erecting barriers right from the beginning. And those are barriers that we can dismantle and we should dismantle. And I've already been having these conversations with my co-chair, Julian Sear, and I do want to recognize his Chief of Staff and General Counsel, Liz Gantz, who's here with us. But thank you, Liz. You did an amazing amount of work to make that bill a reality. Liz deserves a round of applause. But the conversations are already beginning. And actually, I mean, they really never stopped. So I certainly want you all to know that while we are very proud of ABC 2.0, there is still a lot of work left to do, and we look forward to working in collaboration and in partnership with all of you to continue to make improvements for everyone in the Commonwealth, young people included.
I also want to make it a point that Adrian says he came in the 11th hour. He actually never missed a beat, and his patience and his ability to return every one of my phone calls, I will always be grateful for. But actually, it was his commitment. As soon as he was chair, he called me, and as a dad, and because of the community he represents, he was right there. So I really want to make sure that it was the 11th hour. A really comment underestimates how important you were in this. I think a few things I think about is that I'm going to be looking for the hospital execs that are still here to say that, MAH has played a really important role also in helping to write this bill and helping us actually understand what's working in the hospitals, what's falling apart, helping me, quite frankly, understand the payment system and where it helps and where it hurts. So I'm going to continue looking to the Hospital Association, looking to MAMH, looking to a number of other organizations whose eyes are on the ground, really translating what we've passed and how it works, right? Because implementation now of whether it's this bill, the roadmap, the waiver, there's a lot of really exciting opportunity and possibility that's supposed to take place now. And so really, though, understanding how is that translating both in our provider community as well as in our community-based programs and our school programs. So there's a lot of implementation that I think that is like the big thing that is going to, that's not insignificant and will take up a lot of our time. I would say for me, moving forward, two other things will be one of the really important pieces of this that, this bill, this is my celebration. I took a vacation when the bill signing occurred, so I was away. So seeing so many people here who I would have seen that day is exciting. But one of the pieces that we want to really focus on this year or the next session is looking at this advisory council. It is going to be really important that we bring together stakeholders from community-based organizations, advocates, patient advocates, our hospitals, our schools, and a place that really allows us to make sure that the best practices that are going to be developed and captured and shared through both the technical center as well as, requiring schools to come up with an emergency plan for what they will do in response to a mental health emergency. As well as other issues that we addressed dealing with expulsion from early education and alternatives to expulsion for older kids. So this kind of, part of it is that we have so many commissions and so many task force, and I know that we in the legislature want to make sure that when we take this next one, that we really are clear on its mission and how it's going to work and who's going to do the work. So I think that's the next step. And then I will also say, I will just bring this back to, for me, much of my work as an elected official has really been about looking at how we reduce poverty. And quite frankly, reducing poverty for me is about putting more cash in people's pockets. It's that simple. So Massachusetts and this legislature, I'm so proud of the work that we've done, and especially the work that we've led in the House to reduce poverty with families. When we tackle our economic development bill, there's a lot of really important things in there that are going to increase cash into families' pockets, and it's going to actually eliminate some barriers that prohibited additional resources going to our neediest families. But the direct correlation between reducing poverty and seeing better mental health outcomes, the data is very clear. So that is really going to be work that has, I think, been the cornerstone of who I am, and it really is what allowed me to enter this space, and it's going to be where I continue to spend a lot of my time as well in the next session.
Thank you, guys. So we know that change is coming. We have a big day next week, right? And even if all of those changes are in each of our individual views, because none of us have public views right in this room, positive, change is scary. So I, on behalf of on our team, really am grateful that you all will still be there as steady hands and to amplify the voices in this room, the voices of families and youth, and to really help us to be sure that this stays on track with whatever changes come. And so we had Secretary Sudders here a little bit ago. And to some extent, it was a sort of a legacy conversation, or at least pieces of it felt like a legacy conversation. And so I know you're not going anywhere. And I'm not either tomorrow, but eventually we're all going to go somewhere, right? Let's hope. I have visions of beaches and drinks with umbrellas in them, right? And I hope that they're not that far away. So I do wonder, just sort of as a way of exiting on a positive note, when you think about your careers, when you think about the impact you will have had on kids' mental health, how will you know you've been successful? I know it's goofy, Senator, but it's important. What's your legacy going to be?
I'll jump in because I have to go be at a school meeting soon. I think when the communities who I work the closest with and children and people in my own family talk about the need for finding a therapist and talk about the need of feelings in a way that really are not with shame or judgment, but in the same way they would talk about a toothache and talk about eye care, right? And that's going to be because so much of the work that is in this bill, that is in the waiver, and that is in the roadmap will have really trickled down to our communities, right? So it'll go beyond providers. It will be tools that have really helped provide teachers with the right language and for those who need additional language, but also additional tools and providers in our schools. It just will become so, whole health, as Secretary Sudders referred to this, that's where I know, and then the data will show us. When we're talking about this in the same way we talk about needing to go to the eye doctor or the vision or physical, I threatened my husband that he was no longer allowed to come into our room if he didn't get his physical. So just be clear.
I've received similar threats from my wife.
And statistics show that's how, for many partners, that is what works. So get that physical. But that in the same way we're talking about, our mental health. My husband is an immigrant. He lived through war through much of his childhood, and so much humor is used in his family to have to talk about how they survived. But the truth is, we have so many families in our state who have survived trauma here just in the neighborhood through gun violence, or trauma because they were flown here by a heartless governor in another state. There's so much trauma, and we need to make sure that people, while humor is certainly a way that helps us maybe get through the day, mental health care allows us to actually have the tools to heal and to not only laugh about it, but to also not be sick by it.
if you'd like.
Well, I agree with everything Marjorie said, except I don't see that as my legacy. I mean, the sort of what is my legacy? It's the legacy is being part of a group of people who, through sort of, that I get to be part of this. I guess that's what I feel like my particular, I mean, I agree with you. That's how we'll know we're successful. And I do want to point out that we really also have to pay attention to geographic equity, because in this state, you leave a certain corridor and it is a desert. And those people are just, those kids are just struggling beyond as much as everyone else that we sort of identified. So I just wanted to say that it's really, really important. And certainly many of those kids are low income and, but in terms of my legacy, I don't, this is a group effort, right? And it has to continue to be a group effort. And, if we need people at the very top and we need people on the ground. We need the whole, range of people, This was the Senate president set out to do this work, and she sent it out 4 years ago, and she was very clear, this is my number one priority. If you don't have that, you don't even get to start. She didn't tell us what had to be in it, but she said, we got to do this. And if we didn't have that, so there's those people, right? There's the people at the top that say, no, we need to go do this. And then you've got all the people in this room that we've sat down with for so long saying, here's the deal, here's what's really happening, here's what you need to do, and have that push. And then you've got us, very committed, we care a lot about this, to push it over a finish line. So I don't see it as my legacy, I see it as our legacy. This is Massachusetts, and Massachusetts got to do something that they should be incredibly proud of. So I think that's the way I look at it.
First of all, I'd like the record to reflect, Marjorie, that I do have an annual physical scheduled after almost 3 years, thanks to a lot of prodding and threats from my wife. But in all seriousness, when I was asking to serve on this committee in the capacity of chair, the reason why, and this was before we knew we were going to do a big mental health bill, the reason is because these issues are so tangible in our communities, right? Whether it's mental health or substance use, there is not one family, not any corner of the Commonwealth that isn't impacted by mental health and substance use. And for me, having the opportunity to do work that is so tangible, that folks understand when you're in the community, that they feel the positive impacts, it's all about helping people, right? And I know we all feel that way and do that work in our respective roles. But I couldn't think of a committee, especially coming off the heels of Marjorie, who taught me so much about this committee and really showed exceptional leadership when she was chair of that committee. I couldn't think of a better role or a better place for me to try to do that work to help people. And I agree with the senator. I think we put too much stock in legacy. I'm just grateful to have played a small role, along with all of you who played a far bigger role in making these reforms a reality. And they really do represent some of the biggest reforms to mental health in Massachusetts in decades. And that's something we can all, and we should all, be incredibly proud of. But in terms of when I think the work will be done, or when we know that we've created a strong and effective mental health system, especially as it relates to children, stigma has to be part of that conversation, right? When we stop seeing mental health and substance use disorder be stigmatized, I hear it all the time in my community. It's a barrier for treatment and access, right? People are worried about how they'll be viewed or judged. That is a societal problem that we all need to help fix. When we achieve real parity in terms of coverage, investment, and access to care, we certainly took an enormous step in the right direction, finally trying to get at that federal parity law that's been on the books for a long, long time. But when there really is parity, when mental health is treated like physical health. That's when we know we're taking steps in the right direction. And again, because these issues are so tangible, we'll all be in our communities and we'll know when that time comes. I don't think this bill will achieve some of those things. Again, I think it's an enormous step in the right direction, and it's something we should all be proud of, but there's still a lot more work to do. And, again, I'm just grateful to all of you for your partnership and collaboration, and I look forward to the days, months, and years ahead as we continue to work together and we continue to try to tackle these issues for folks here in the Commonwealth. So thank you so much for the opportunity to join you today.
Well, thank you. I know that I speak for everybody in this room when I say that there is no group of people that we would rather be hand in hand with in this work, and we look forward to the next steps with you. I do have a hand up, but I don't know if I have time for a question. Do I? I need to wrap up. My apologies, sir. Yep. So thank you very much. Appreciate your time. Thanks for coming, you guys.